politics, I think, ended up trumping practical common sense. You know, I said at the State of the Union, and I'll repeat, I didn't take this on because I thought it was good politics. This is such a complicated issue that it's inevitably going to be contentious. But what I'm hoping to accomplish today is for everybody to focus not just on where we differ, but focus on where we agree. Because there actually is some significant agreement on a host of issues. I mean, I've looked very carefully at John Boehner's plan that he put forward. I've looked at Tom Coburn and Senator Burr's plan that's been put out there. Paul Ryan has discussed some of the issues surrounding Medicare. I've looked at those very carefully. Mike Enzi, in the past, you've put forward legislation around small businesses that are very important. And so when I look at the ideas that are out there, there is overlap. It's not perfect overlap. It's not 100% overlap, but there's some overlap. Now, what I did, what the White House did several days ago was we posted what we think is the best blend of the House and the Senate legislation that's already passed. The basic concept is that we would set up an exchange, meaning a place where individuals and small businesses could go and get choice and competition for private health care plans, the same way that members of Congress get choice and competition for their health care plans. For people who couldn't afford it, we would provide them some subsidies. But because people would have some pooling power, the costs overall would be lower because they'd be in a stronger position to negotiate. We think it is a plan that works with the existing system, the employer-based system, the private healthcare system, but allows a lot of people who currently don't have health care to get health care. More importantly, for the vast majority of people who do have some health care, it allows them to get a better deal. We also have some insurance reforms in there that, for example, prohibit people who have pre-existing conditions from being banned from getting coverage. We also talk about how we can help to make the Medicare system more effective and provide better quality care. In each of these cases, there are corresponding ideas on the Republican side that we should be able to bridge. So I promise not to make a long speech. Let me just close by saying this. My hope in the several hours that we're going to be here today, that in each section that we're going to discuss, how do we lower costs for families and small businesses? How do we make sure that the insurance market works for people? How do we make sure that we are dealing with the long-term deficits? How do we make sure that people who don't have coverage can get coverage? In each of these areas, what I'm going to do is I'm going to start off by saying, here's some things we agree on. And then let's talk about some areas where we disagree and see if we can bridge those gaps. I don't know that those gaps can be bridged. And it may be that at the end of the day, we come out here and everybody says, well, you know, we have some honest disagreements. People are sincere in wanting to help, but they've got different ideas about how to do it. And we can't bridge the gap between Democrats and Republicans on this. But I'd like to make sure that this discussion is actually a discussion and not just us trading talking points. I hope that this isn't political theater, where we're just playing to the cameras and criticizing each other, but instead are actually trying to solve the problem. That's what the American people are looking for. As controversial as the efforts to reform health care have been thus far, when you ask people, should we move forward and try to reform the system, people still say yes. They still want to see change. And it strikes me that if we've got an open mind, if we're listening to each other, if we're not engaging in sort of the tit for tat and trying to score political points during the next several hours, that we might be able to make some progress. And if not, at least we will have better clarified for the American people what the debate is about. So with that, I just want to say again how much I appreciate everybody for participating. And I am going to now turn it over to Senator McConnell so that he can make some opening remarks.